Me too. Okay, I'm set.
Great. Hey, well, look, it's great to be here with Honourable David Seymour, Deputy Prime Minister, and we're here to make an announcement in relation to access to medicines, particularly to support and encourage the increased access to medicines at community pharmacies up and down our country. Today's announcement is about Pharmac consulting on providing the funding for a range of medications which typically patients would need to either purchase over the counter at a pharmacy or go to a GP in order to get those medications prescribed. Through this announcement today, patients will be able to access those at a subsidised rate via Pharmac. That will save them money, but also mean they will save them the requirement to have to get a GP appointment. That takes pressure off our GPs and also takes pressure off our hospitals. Ultimately, today's announcement is about ensuring we also use the amazing talent that we have in community pharmacies up and down our country. Our pharmacists are highly trained and able to prescribe a range of conditions. And the conditions that Pharmac is consulting on are common conditions, particularly which affect families with young children, such as scabies, head lice, conjunctivitis, but also other conditions such as urinary tract infections, which is a common condition for many women as well. This will mean that those patients will be able to come to a pharmacy, have a consultation, and receive those medications at the subsidised rate that they would if they were to go to a GP. So it's all about increasing access to medicines and making sure that patients can be seen and treated through one consultation at a pharmacy. It's an exciting step forward for community pharmacists up and down our country, and we're proud to be part of a government which is increasing access to medicines right across the board. I'll now pass to Honourable David Seymour, who's the Minister responsible for Pharmac, and I know he's been an incredibly passionate advocate for increasing access to medicines for patients across New Zealand through his work, and I'll pass to him now.
Yeah, look, thank you, Simeon. And look, this is a really important recognition that pharmacies are the healthcare professional closest to you for most people, allowing more treatments to be prescribed and handed out from pharmacies means that we save community pharmacy. Many have been closing. We provide greater convenience to patients and parents, and we also take pressure off GPs and emergency departments. It's actually a triple win-win-win for the patients, for the GP and emergency department network, and also for the government, because we need to become more efficient. I remember when I lived overseas, I was always surprised that people didn't always go to their doctor. And I thought, man, what sort of third world country is this? They should go to a doctor like we do in New Zealand. But I've come to understand over time that we often have GPs doing things that other professionals could do more efficiently, and that actually leaves time and money on the table that we could use for greater health. This for parents who have a child with a fever, with high temperature, with oral dehydration, they can go to the healthcare professional closest to them instead of having to wait weeks sometimes for a GP, or go to an emergency department where the lines are long and the chaos is sometimes intolerable for people trying to get really urgent care. This is an example of a government that works together well, that thinks carefully about the resources we have as a country to solve more problems without throwing more money at it. So Pharmac will be consulting, because at the moment we in Pharmac fund these medicines if they're prescribed by a doctor. We're going to make sure that they're funded so you can get them taxpayer funded regardless of whether it's a pharmacist that does the consultation or prescription or a GP.
So thank you so much for being here. Happy to take questions, but great day for patients and their families, and a great day also for community pharmacy.
It's been reported that Green Cross Health, who own Unichem and Life Pharmacy, and also the brand The Doctors, who have a number of clinics throughout New Zealand, are talking with potential buyers. I guess in light of how we know that community pharmacies have been struggling and we want to retain them as much as possible, what potential impact could that have if that is sold?
Well, I can't speak to the commercial arrangements of Green Cross and Unichem, but what I can speak to is that this is about supporting community pharmacists up and down our country. These are highly trained healthcare professionals who have the capability and training to be able to prescribe these medications. it's also about patients and improving access, particularly for parents with young children. Children who have a fever, head lice, conjunctivitis. This is about increasing access to medicines for those parents, and making it easier for them to be able to have their children treated closer to home without having to wait weeks for a doctor's appointment. So this is great news for patients. It's also about maximising our workforce in community pharmacy, who do an amazing job each and every day, and this helps to unlock and support that workforce and the important work they do in our community.
This potential sale, though, I mean, are you worried that it could impact job losses of our community pharmacies and pharmacists?
Look, ultimately we are a government which really supports pharmacy and the role that they play. We want to see pharmacists working at the top of their scope, and this supports them to do so. And as to the commercial arrangements, those are questions best put to Green Cross and to Unichem. What we're focused on is improving access to medicines, supporting our community pharmacists to work at the top of their scope, and through this, we want to see community pharmacy delivering more in the community, which is great for them and great for patients.
Look, I think it's fair to say too many community pharmacies have closed down. That's a huge loss for communities up and down this country. This gives more opportunity for pharmacists to use their skills and in return draw more people in and attract more revenue while taking pressure off the GPs and emergency departments. So like I say, it's actually a win-win-win.
Absolutely.
The subsidy for some of these medicines, obviously it'll differ with each case and whatever health issue it is. But how much could this make things cheaper for people by, if you've got any examples?
Yeah, so just to give you an example, if you've got 3 children, you could pay up to $100 over the counter or to purchase head lice shampoos from a pharmacy. If you were to come and see a community pharmacist, the prescription cost would be free if you've got a community services card, or $5 if you are someone without a community services card. So that's a significant saving, but also the time that is saved without having to go to a GP to get an appointment and wait. This is about you can come into a community pharmacist close to where you live, be seen and receive your treatment all within a matter of hours, if not minutes.
And I guess in terms of time frame, there'll be a consultation from Pharmac on this, but all going well, when could this happen?
So we're working towards delivering this from the 1st of June. So Health New Zealand and Pharmac are working together on this program, working closely with community pharmacy representatives. And as David said, this is about strengthening community pharmacy, providing them more opportunity to deliver more services in the community, but also providing more opportunity for parents and families to get medication and medicines closer to home, to be able to be seen and treated, taking pressure off our GPs, taking pressure off our EDs. It's a win-win-win.
All right. Any more questions? Otherwise, we're very grateful for you showing up, and also very grateful to the pharmacy here and the great pharmacists for hosting us. Thank you very much.
Yeah, thank you. It's wonderful to be here.
All right.
Thank you very much.
Do you need a pharmacist?